Alpha Palliative Care was established in 2005 in Thrissur district of Kerala by Sri K.M. Nurdin under the Alpha Charitable Trust. Alpha aims to provide quality palliative care free of cost to every citizen of India. Now, it was started in 2005, almost more than 15 years have passed. What have they done? Here is the record of Alpha in 2020. In 2020, Alpha Palliative Care had one hospice with 24/7 patient family and 17 link centers with day care, home care and Punarjani neuro rehabilitation facilities. Palliative care being active total care of patients with life limiting illnesses require a team approach. They follow an interdisciplinary team approach and their team consists of trained doctors, physiotherapists, speech therapists and trained volunteers. What is the policy of Alpha Palliative Care? They do not allow any discrimination in the name of caste, religion, financial status or politics among volunteers or patients. Community owned clinics are established by sensitizing the general public by conducting awareness classes about palliative care needs and training the selected volunteers. Resources mobilization is from the local people and they ensure people's participation right from the beginning. Alpha Charitable Trust, which governs this Alpha Palliative Care project, it monitors the financial activities and ensure that the auditing of accounts are done properly and regularly. Whom do they serve? They serve all bedridden people, all patients with organ failure, chronic kidney disease, liver disease, respiratory failure, heart failure, etc. Advanced Parkinsonism, dementia, etc. All cancer patients, all patients with restricted mobility due to stroke, spinal cord injury, head injury and children with cerebral palsy like disorders, etc. Now, who run these clinics? We call them link centers. Community owned clinics run by trained local volunteers, that is neighborhood network in palliative care, NNPC. These volunteers, they form the NNPC and they run these link centers. Then they have got the support of trained doctors and nurses. These doctors have been trained for 6 weeks, whereas nurses have been trained for 6 weeks to 3 months. So, that means these volunteers are being provided medical support by trained doctors and nurses. Patients are identified by local volunteers and then resources are mobilized from local public. Home care. What are the salient features? Care at home by trained doctors, nurses and volunteers. Active listening to patients and family. Active listening is an important part of therapy. All these volunteers and the professional team, they listen to the patient, their problems and then later on they carry out some sort of palliative care. They assess symptoms and manage pain and distressing symptoms like nausea, vomiting, constipation, etc. They also provide psychosocial support. Punarjani it is a neuro rehabilitation center for the mobility restricted, and all these services are, my dear friends, free of cost. This is the home care being provided at the home of the patient. Here the trained nurse is taking care of oral care. Let us know something about Punarjani. Punarjani is a Sanskrit word to translate. It is a neuro rehabilitation program. Patients are brought to the clinic in rotation. Clubs have been formed according to the disability. Clubs of the patients have been formed according to the disability, that is stroke, spinal cord injury, children's own club, etc. Club days are occasions for patients get together and emotional support also. They provide assistive devices to improve the quality of life, like wheelchair, walker, tricycle, etc. And excellent results due to better compliance and patient satisfaction have come up from this particular project, Punarjani. Alpha model palliative care is being administered by Alpha Charitable Trust. It has a hospice with 24/7 inpatient facility in every district headquarters, link centers with daycare and home care facility in each block panchayat, Punarjani centers in every link center, recruitment and training at Alpha hospices. This recruitment and training is of volunteers. Procurement and distribution of morphine from Alpha hospices, community owned link centers and hospices. This is how the Alpha palliative care functions. There is a hospice in every district center, and this hospice is available 24/7, and this hospice is connected with different link centers in the nearby villages. Monthly service output: 200 nurses home care, almost about 200 nurses, they go and provide home care, 50 doctors, 300 physiotherapy outpatients, free medicines is given to the patients, financial aid, rehabilitation support for house construction, repair, educational support for patients' children, marriage assistance for unwed daughters. So, basically they are providing not only medical care, but they are providing moral support, educational support, financial support and psychological support. Holistic care for 250 patients with one home care team. Provide rehabilitation to 50 Punarjani patients every month. Training of volunteers, conducting awareness classes for general public. Patients get together are being planned regularly, and rehabilitation activities. Lots of expenditure is so much, salary is almost about, they spend more than 1,50,000, even the medicines, fuel expenses, rent, maintenance. This is for each link center, and there are more than 40 such link centers in Alpha palliative care. Lessons learned: community owned clinics are the answer to our country's palliative care needs, because organizational medical care they cannot look after. What we require is the community participation, and that is how in India and particularly in Kerala they have come up with the idea of neighborhood network in palliative care. We could achieve good death in 90% of patients by ensuring quality care at doorsteps. In India, everybody, most of the people want to die at home. You ask yourself, where do you want to die? In some ICU somewhere? When your kith and kin and very fast relatives, they are not available, you can't see them. Therefore, most of the people in India, they want to die at home, and that is why palliative care support should be given at home or maybe in hospice sometimes, but not in ICU or in any hospital where relatives just cannot talk, cannot touch the patient. Alpha palliative care model can be replicated everywhere in India, which is cost effective and sustainable. Dear friends, I have gone thrice to palliative, alpha palliative care. I visited number of link centers and I am really satisfied. I am amazed how they work, Volunteers, the block sarpanch, it is a very cohesive team. They happen to get some training, regular training, occasional training from alpha palliative care, and then thereafter they become an independent unit. Community ownership in palliative care. This is the case example which has been given out in one of the paper. The Kerala Neighborhood Network in Palliative Care is a community-led initiative that recognizes the need for a different model of care for people with chronic and incurable diseases. Doctors and nurses provide clinical care and trained volunteers provide psychological support. Community ownership also applies to funding, with people in the community donating a few rupees at a time and collection boxes sited in shops and bus stations, and there is good media and political support. The program is being replicated in the state of Pondicherry and in some districts of West Bengal, in Imphal, in Manipur and in few districts in Tamil Nadu. It is getting good response from other states of India. This is the team Alpha Palliative Care, and this photo was clicked by after that wedding project. This is again the team of Alpha Palliative Care. Thank you.